Hello, I'm Ross Silverman, member of the Board of Directors of the Indiana Health Advocacy Coalition, an interdisciplinary 501c3 organization that brings healthcare providers, lawyers, public health professionals, academics, and other advocates together to enhance comprehensive patient-centered care in Indiana. This podcast is brought to you as a prelude to the 2019 Indiana Health Advocacy Coalition State Conference, where one of the key topics will be addressing lead poisoning through medical legal partnerships and advocacy. And we couldn't have a better person to discuss these issues with than my guest today, which is Emily Benfer. She is a visiting associate clinical professor of law at Columbia University Law School, where she directs their health justice advocacy clinic. Professor Benfer is a nationally recognized authority in the field of health justice, with a deep commitment to preparing the next generation of advocates. Her area of clinical practice and research includes health equity and social justice, interprofessional education and collaboration, environmental and racial justice, and medical legal partnership. Prior to joining the Columbia faculty, Professor Benfer was a visiting distinguished scholar and senior fellow at Yale Law School Solomon Center for Health Law and Policy. From 2010 to 2017, she served as a clinical professor of law at Loyola University Chicago School of Law and Loyola University Chicago Stritch School of Medicine, Department of Public Health. At Loyola, she founded and directed the Health Justice Project, a fully integrated medical legal partnership at Erie Family Health Center, in which providers, lawyers, and law students collaborated to resolve the social determinants of poor health for patients. The Health Justice Project received the CLIA Award for Excellence in a Public Interest Case or Project for Student Leadership in an Interprofessional Advocacy Campaign, based on their work to protect the 4 million children in federally assisted housing nationwide from lead poisoning. In addition, the Health Justice Project received the Outstanding Medical Legal Partnership Award from the National Center for Medical Legal Partnership. And since I'm faculty here at the Indiana University McKinney School of Law, I must also include the fact that we are proud to call Professor Benfer a graduate of the IU McKinney School of Law. Welcome to our discussion today, Emily.
Thank you, Ross. It's such a pleasure to be here, and especially to be joining folks in Indiana, as I really look fondly back on that time at the law school and all the incredible people working there.
So can you talk to us a little bit? Lead poisoning is an issue that really has come up in the last couple of years based upon what had been occurring in Flint, Michigan, but it's by no means limited to that area as far as being a public health concern. Can you talk a little bit about how you began examining the issues of lead poisoning and getting engaged in policy issues related to lead poisoning?
Yes, absolutely. So as you mentioned, I directed the Health Justice Project at Loyola University Chicago, and it was a fully integrated medical legal partnership with a federally qualified health center, which meant that most of our patients and our clients were low income, marginalized, and living in very impoverished areas that had substandard housing. Across the country, over 23 million homes contain at least one lead hazard, and there are 38 million that have lead-based paint that will eventually become a lead hazard if not closely monitored. And so what we started to see was this influx of referrals of families whose children were being lead poisoned at very high rates. And one of the aspects of medical legal partnership is that you start to surface systemic problems and policy issues when you meet families because they're clustered in specific neighborhoods or even in the same building. And I remember one family in particular, the Walker family. They had a housing choice voucher program, which essentially means that the federal government pays for your rent in the private market. And when they came to us, Mrs. Walker had already contacted the Chicago Housing Authority 3 times and told them, "My 9 children have lead poisoning and their levels are rising. Please move us to a different home." And each time the Housing Authority told her, "Your children's rising lead levels are not an emergency that would warrant moving papers." And they were right. Federal law at the time required that children in the Housing Choice Voucher Program, in fact, in all federally assisted housing, obtain lead levels 4 to 5 times the CDC reference value before any interventions were required. So this was really our first introduction to this systemic issue and the harm that it was causing to children, that children are essentially across the country lead detector devices, that were testing the kids instead of the homes.
So, could you dig a little bit deeper when you talked about the fact that you were starting to see an influx of referrals? You mentioned in this particular case that the client that you had came after multiple attempts to work with the Chicago Housing Authority. Was that kind of the typical circumstance, or was it with an initial diagnosis of elevated lead levels? What are the kinds of markers that you would see within the MLP setting that would flag this as a potential lead poisoning and a possible legal intervention issue?
Mm-hmm. So one of the benefits of medical legal partnership is that it's designed to address the social issues that result in poor health outcomes. And so through constant collaboration and conversations with the medical providers, we were able to identify some specific social determinants of poor health that would result in long-term consequences for families and children. And one area that was particularly concerning for the providers was this rising influx of kids with lead poisoning. And so they started to refer them to us. And we were able to identify some of the hotspotter buildings that should be targeted. And at the same time, what the source of income was. And we saw this pattern among the voucher program, that there were more and more kids being referred to us who lived in the voucher program. Another family, her son had been lead poisoned from the age of 18 months to 6 years of age in 4 different housing choice voucher units. He is now autistic. He lost the ability to communicate and will be in special education for the remainder of his educational years and need a lot of support after that. All of these health impairments that the children were experiencing were completely preventable, especially because the housing choice voucher program has a higher standard for inspections than the private market, that they all have to go through this housing quality inspection. However, we learned that the lead poisoning prevention rules, the lead safe housing rule, hadn't been updated since the Reagan era. So the interventions they were using, the inspection that they were using, actually wasn't based in science at all, and it wasn't effective in identifying lead poisoning hazards in a home. So instead, in essence, the federal law governing these programs takes a wait and see approach that delays lead hazard inspection until after the child is lead poisoned. And at the time of these referrals, the lead poisoning rates were so high, causing significant impairments for the children who were exposed. So one of the things that we did, we thought, this doesn't work. We can't use tax dollars to poison children. I mean, we can't allow any child to be exposed. But especially in the federally assisted housing program, there are rules and regulations in place, and we need to make sure that the standard is high enough to protect children. And we learned that the housing choice voucher program and project-based Section 8 receive a different level of inspection standard than all other federally assisted programs. So we decided that we were going to petition HUD for rulemaking under the Administrative Procedure Act. And we convened a big tent coalition across the country of advocates and organizations and scientists from children's organizations, environmental justice, housing, public health, to ask HUD, in fact, to demand that HUD, 1, update the definition of lead poisoning that triggers intervention to match the Centers for Disease Control and Prevention standard. And 2, to require a meaningful inspection before children moved in. That we can't afford to wait and see if a child will develop lead poisoning before an intervention occurs, that we need to find the hazard first, repair it, and then make the home safe for children to thrive. And a number of other things that we wanted them to update. And they responded affirmatively, that they actually did, as a result of that petition, update the lead safe housing rule in 2017 to match the definition of lead poisoning to the CDC reference value, which is 5 micrograms per deciliter. And it will be updated as the CDC updates their reference value. They declined, however, to identify the hazard before the children are exposed. That is not acceptable in any way. That as a result of those policies, children in the Housing Choice Voucher Program across the country are suffering from lead-related ADHD, special education needs, juvenile delinquency issues. They're related to lead poisoning, to lack of attention and behavioral problems, and on from there, and they will suffer consequences in adulthood as well, that this goes on forever. And the neurological harm is permanent. We cannot reverse it. So the only thing that we can do, and the American Academy of Pediatrics, the American Public Health Association, the CDC all recommend, the only thing we can do is engage in primary prevention that will identify the hazards before the children are exposed.
So can you talk a little bit now, as essentially, I mean, as you're trying to continue to refine and reform the policy and the implementation and enforcement to make sure that it's effectively enforced even under the current standards. So what steps on a day-to-day basis can be done in a medical legal partnership setting to minimize the harms that can be caused from a lack of lead abatement?
So I think there are a few things. The first, there are so many innovations in data and identification of people before they're exposed. So for example, the federally qualified health center, Erie Family Health Center, that we partnered with, after we started to see this influx of lead poisoning cases, they adopted a system that used the electronic medical record to flag high-risk neighborhoods so that those children were immediately tested for lead poisoning and their parents were informed about the risks of lead hazards and what to look for in their home and what to demand of the landlords. And then at the same time, they were referred to the Medical Legal Partnership for support. So you can really get ahead of the problem by using the evidence that we've already collected. And second, find the champions within the Medical Legal Partnership who are lead poisoning prevention advocates, who understand the severe harm that lead poisoning causes individuals and children and how it thwarts their growth and their potential, and partner with them to tackle policy locally. Across the country, there are only 17 cities and states that require we identify the hazard before a child is exposed. That's it. Everywhere else, the child is the lead detection device. And as a result, they suffer permanent brain damage. And I think there are more and more providers today who are recognizing that lead poisoning is actually not a thing of the past, that there are approximately 1 million children who are currently lead poisoned, according to the CDC estimates. And the cost of this, if we were to take one cohort of children born in 1 year who have lead poisoning levels from 2 micrograms per deciliter and above, the costs of this are as high as $10.9 billion. That's extreme. And instead of spending all of the money on the effects of lead poisoning, immediate medical intervention, the treatment of lead-related ADHD, parental work loss because of time you have to take off to care for your children, the medical costs associated, the special education required, the lost lifetime potential earnings, those costs are significant. We can be shifting that to a primary prevention model where we identify the hazard before the child is exposed. And we should also be testing kids as soon as we can to try and find them and to find the source of the hazard so that the exposure is not chronic and long-term, causing even more harm.
Can you talk a little bit about how within your advocacy you center the voice of those who are impacted as contrasted with perhaps you as the professional?
Mm-hmm. So the public health model, the community-based participatory response, I think is really critical to any kind of meaningful social change and health equity movement. And this means that the people most affected by an issue are really the only ones who can decide and determine how a policy or a law will play out in their own lives and whether or not it will be effective. And so it is critical to bring people affected by these issues to the table to make sure that they have a seat. And even if that means that your voice doesn't need to be at the table, that you step back and let them have that space. And we've found, with equal partners of parents whose kids have been exposed, all of us together have found that that's incredibly effective. We were fortunate enough to have a roundtable with Senator Durbin in Illinois, and we asked the mothers if they were interested in speaking with him. And sure enough, they rose to the occasion and were the most powerful advocates, in his words, that he has ever met in his entire career. I don't think there was a dry eye in the house that day when we heard about what happened to their children who were on their way to having a bright future. And then one day, as one of the mothers said, the lights just went out. I can't imagine being a mom myself, missing out on the children I knew and watching them go down this downward trajectory, forced to struggle to confront barrier and barrier, and constantly trying to support them as they wonder why they aren't able to keep up with the other kids, why they can't concentrate, why they're no longer excelling. It's heart-wrenching, it's inhumane, it's a plague on society, and something that we can certainly eliminate. And we can do it by making sure that people who've experienced these issues are at the forefront of change.
Finally, can you talk a little bit about how a local effort, perhaps a medical legal partnership in one small community, can link up or connect up with national, with the work going on a federal level?
Great. So across the country, as you mentioned early on, that this really was brought to the attention of the public after the Flint water crisis. But we've learned since then that across the country, rates of lead poisoning are even higher in some cities. So this is an issue that is truly affecting everyone in the United States, and that we can come together around to cause change and to demand that our children's lives and livelihood be protected. Now, in terms of the federal advocacy, there are about 6 different bills right now that have been introduced in both the Senate and the House, and the voice of individuals on the local level are needed to inform how those will play out, and to make sure that decision makers are hearing from constituents that this is something that's a priority, and that it should be our leaders in Congress' priority as well. One example is the Lead Safe Housing for Kids Act. I mentioned that federally assisted housing does not undergo lead hazard inspection, and that it should. Well, bipartisan groups of senators and members of Congress recognize this and have introduced the Lead Safe Housing for Kids Act that would require pre-rental lead hazard inspections in all federally assisted housing. This is the gold standard. It's what we want in the private market as well. And I think we can make the case through this bill, through this legislation, that we need to extend it to all households, to all kids. But this is one area that we can get involved together and demonstrate the need for change.
Well, thank you so much, Professor Benfer, for taking the time to talk with me today.
Oh, it's my pleasure. I think, what would it be like if we could all just imagine if we didn't have these poverty issues connected to lead, if we didn't have the brain damage connected to lead? What if we could reckon with this legitimate social problem, with this Gordian knot? We would have more productive school districts. We would have more productive members of society. We would have children whose brains are working with the IQ that they were blessed with at birth. And that is the choice that we have to make. Will our children have a brighter future, or will they be forced to go down a downward trajectory? And I think we all know what humanity demands.
Absolutely. Well, thank you again for taking the time to talk today. To find out more about the 2019 Indiana Health Advocacy Coalition State Conference, which is coming up on August 28th, 2019 at the Ivy Tech Community College Conference Center in Indianapolis, check out and like the Indiana Health Advocacy Coalition Facebook page. For more information about IHAC, you can find us online at www.ihac.info. Sign up for our newsletter by emailing us at contact@ihac.info or catch us on Twitter at ihac_info. Thank you again, Professor Benfer, and have a great day.
Thank you.